We are primarily focused on how we can use virtual reality for physical therapy, such as using avatars and other virtual environments to retrain people how to walk after some sort of neurological or structural insult, such as a stroke or knee surgery due to an anterior cruciate ligament or ACL tear. So that was really kind of what dawned on me, is the technological advances that have gone on in virtual reality and all the potential uses for virtual reality in not only gaming and movies such as Avatar, but then how we can ultimately use those same analyses and that same technology to help create more defined and optimal rehabilitation programs. So this research requires the ability to integrate lots of different things, including understanding the pathology. So from the clinical perspective, what causes these changes? Is it the change in the structure of the knee, the musculature, those kind of things? But also an understanding of the math and physics behind that, and then the technology that you can use to not only study that, but also to help rehab folks. On the behavioral side of things, if you are predisposed to a trip and fall, or if you can't maneuver around a pedestrian or a moving car, that really causes potential for injury and some other types of major catastrophes. And so we want to avoid those. So we try to get down into the nuts and bolts as far as what's going on within the human body, understanding their mechanics from a structural or neurological insult, and then ultimately how can we fix them. And virtual reality came into play because it's really a unique tool in that we can produce anything in virtual reality that you want as long as you know how to do the programming. So you can have virtual environments that have avatars that are doing different types of activities that you ask the patient to synchronize to. So if the patient has lost their adaptive patterns due to the structural or neurological insult, then what you can do is you can build those patterns back into the avatar and then have the patient synchronize to what the avatar is doing. It gives you a very prescribed way in which you can retrain the patient and not have to rely on the physical therapist to be there every second. So the physical therapist would certainly be there overseeing all of the patients, so we don't want to get rid of physical therapists. They're very important to us. But it would offload a lot of the kind of mundane training that the physical therapist would need to do, and could potentially lead to some higher efficiency in the way that the physical therapist could interact with their clients. Not only could this training in virtual environments occur in the clinic, but long term we envision that we could potentially develop a Nintendo Wii or Microsoft Kinect type of version for this type of training. We are certainly excited to produce all of our research in a scientific type of domain, but at the same time, the thrill is getting to show off the stuff that really works, and then the disappointment is still saying, all right, this is what we tried, it didn't work, but this is how we're going to move forward from there.